Well, hello friends. We are back to talk about each drug that you are administering to yourself during the 3-week or so process of harvesting your eggs. Okay, so I'm going to turn the camera over and talk to you a little bit about each drug. Alright, so these are all my goodies for right now. All the things I will be taking over the course of the next 3 weeks or so. In addition to birth control, which I don't have out here, of course you start on birth control if you're not already on it, and then continue that for the next week or so. I'll be on it. So this first one here, I will be starting tonight, is Lupron. This is the generic version, but the nurse keeps calling it Lupron, so I'm going to call it Lupron. So that's the first one, and it is injected. You only do about 10 units a day. It's an everyday injection, and it's really not very much at all, and it's really not painful. I practiced on myself this morning at the doctor's office just to make sure that I was comfortable giving myself injections, and they're totally good about it and very patient and help you through the whole process, and it's really not hard or painful at all, and you'll see that in future videos. Okay, so the second one here, I'll start probably in the next 10 days or so. In addition to the Lupron, I will take this one, and it's called Follistim, and again, it's injected. It's like an EpiPen, you can kind of see, and you kind of just put the medicine inside the little pen part, and you click the top, and you inject it. Again, all these drugs are injectable, so you have to be a little okay with needles to want to be a donor. Okay, so in addition to the Lupron, there's Follistim. These are some extra needles here for my next drug, which is Menopur, I guess is how you pronounce it. I can't remember how she called it. Menopur. And again, this one's injected, but this one you have to mix. So it comes in a powder as well as a saline solution. I believe it's saline solution that you mix with it, and then it becomes the drug, and then you inject it. And here's some extra needles here for you. These little guys, they're just little guys. They don't hurt at all, I promise. And then, okay, the last drug that you take, this is 2 days before retrieval of your eggs, is this guy. And this is a big needle, and this one goes in your bum. All the other ones can go in your thigh or your hip, but this one goes in your bum. So I'm not looking forward to that one at all, because it will probably hurt. Okay, and safety first. You put all your old needles in this little sucker, and then you can bring it back to the doctor's office on the day of retrieval. And then we've got this, yeah. These are just, one is an antibiotic. The one on the right, I think, is the antibiotic, and then the one on the left is Valium, just basically for a day of. Actually, the antibiotics you take for 5 days before retrieval of the eggs, and then the other one is it's just Valium for a day of, just for pain. Okay, so these are all my drugs, and I will be taking them starting tonight, this evening, at 10 o'clock. I will inject my first dose of the Lupron, and I'll let you know how that goes. There'll probably be a video of it. Thanks.